Good evening, good morning, wherever you are joining us from. And thank you so much for taking time to join the first webinar organized by Action, that's Asia Collective on Women's Nutrition. This is a collective that is of 20 organizations across Asia to improve women's health and food access through policy advocacy, rights-based approaches, and data-driven solutions. Population Council Consulting acts as the primary secretariat for action along with UNICEF. My name is Avishek. I have been working as the Director for Program and Policy Science at Population Council Consulting, New Delhi. And it's my privilege to join today with two of my dear friends and colleagues, distinguished leaders in their respective field, Dr. Vani Sethi, a renowned expert in nutrition systems who has been instrumental in advancing women's nutrition across the Asia Pacific region and currently with the Global Practice for Child Nutrition and Development at UNICEF's Global Program Division. We have Osama Manzar, who is the founder and director of the Digital Empowerment Foundation, DEF, whose pioneering work has helped expand digital inclusion and access to technology for underserved communities across India. Welcome to both of you. Friends, AI is entering public health faster than many of us could imagine, right? From predicting malnutrition risks to powering nutrition counseling, AI promises better decisions, better outcomes. But at the same time, it also raises some difficult questions. Today's discussion, we would focus on whose realities are reflected in the data, who has access to these tools, and who might be left behind. Some of these critical questions we would like to unpack today. And this webinar, which is the first, the series seeks to critically examine the intersection of AI, women's nutrition, social justice in the whole of Asia Pacific region. It seeks to strengthen dialogue around data justice, around digital inclusion, around rights-based innovation, while encouraging more grounded and community-informed approaches to AI deployment. Recently, we kind of had participated in the AI summit that we had in India, uh, and we saw a lot of enthusiasm and uh, people are sharing their learnings experiences on use of AI. So today I just have two slides to kind of indicate um, where AI has been using or being used, especially in the nutrition space. I would find four broad areas. One, to detect. AI is being used for risk prediction, surveillance, so that kind of work. AI is also being used for personalized counseling, be it diet or behavior change advice, or other chatbot, WhatsApp chatbot, or app-based recommendations. It has also been being used for increased reach, to reduce the barriers around language, or improving the access, especially in settings with low literacy or limited smartphone access. It has also been used in especially in the front for the frontline health workers to help and support in their day-to-day work, so that they can screen, refer, and counsel more accurately. On the ground, we again saw some pertinent example from India, Bangladesh, and many other Asian countries. We have seen that Kilkari from India or Apanjan in Bangladesh, they have been using these weekly IVR calls to which is helpful, especially to provide nutrition-related messages in regional languages. Although it's not a pure AI, it's a kind of a rule-based algorithm. Arman, with help of Google research, they have been truly, genuinely using AI for through machine learning models to predict which mothers are most likely to drop out, which have been proven quite informative. We have also again example from Portion Tracker, Khushi Baby, which helps the frontline health workers to log and monitor about the nutrition, the journey. So we see that promise is real, uh, but the women who are most affected by malnutrition, they are the least represented in the systems. So what do we choose, innovation or exclusion? So today's discussion especially kind of focus on that particular aspect of innovation versus exclusion. So without further ado, let's first start understanding the problem before we go to the technology part. So I'll first come to Vani. So Vani, you have been working in this region for so long. So when you look at across the Asia Pacific, what worries you most about women's nutrition today? Like, not the statistics, but the women who are falling through the cracks of our system. If you would like to share your thoughts, Vani. Pita, you may need to unmute. Okay. You are on mute, Vani.
Again, okay. Thanks, colleagues, for really hosting this and taking the leadership on this agenda. We can't do this alone, and this is the reason why several organizations have come together under action. And great appreciation to Osama, my old friend and team, as well as Avishek to take the baton on a very difficult topic. That is, what do we work on women's nutrition? Who's left out? And in this digital age, and a lot of discussion around AI. Uh, what does it really relate to for women's nutrition? You asked a very simple question that which was not related to AI, so I'm not going to touch on AI part, but I'm going to touch on certain issues of malnutrition which worry me and which I feel need to be brought to center stage. So in the Asia Pacific region, it's one of the regions which has the largest population of women in the world. And so, whatever happens here in this region, in 35 countries here, it really dictates what happens globally as well. And three things are actually worrying me for malnutrition. The first is a lot of the historic nutrition programs have been very oriented to really diagnose singular interventions and tailor programming around those singular interventions, and also then present the data by the singular interventions. However, in a particular geography today, in a woman is not suffering from just one malnutrition problem. A woman is suffering at least from two forms of malnutrition problems, and programs are not designed for double duty actions. This means that, for example, a woman may be suffering from micronutrient deficiencies, which could be due to nutrition causes here, but we're programming only for iron deficiency and not other nutrition deficiencies. But in addition to micronutrient deficiencies, which could be because of any vitamins and mineral deficiencies, she may also be suffering from overweight obesity. So the coexistence of micronutrient deficiencies with overweight obesity is a very big problem. And programs, whether they're in their design, in their monitoring, in their visibilizing the issue, they're actually discussing singular forms, but a woman is suffering from two forms. So, what is the prevalence of double duty malnutrition? What is the prevalence? What is the extent to which double duty actions are happening? That's one. The second of the third thing that is really worrying me is averages. We're discussing averages and we are both rejoicing on it. And at the same time, we are um, mourning programs where averages are not working. So neither are we seeing the positive subnational exemplars, which may be working and which could be in the poorest geographies. But at the same time, we're really rejoicing on averages. So you have two, three countries which have released these big data sets, not data sets, data surveys, and a lot of analysis is going on. And whatever analysis that you see, which is a lot of AI driven supported, is always discussing singular intervention and averages, but you're missing out. But what troubles me most right now is that we're overlooking women, and we are overlooking women who are not in the system, and we are tapping women who are only in the system, and we are normalizing it. For example, a woman who doesn't speak a particular language is turned off from a clinic. A woman who doesn't have a phone or does not have time to access a counseling or service is not there. A woman may be sitting in front of you and you're giving services to the child but not to her. Women who are not pregnant, who are married but don't intend to have a child, they're going to be missed out of programs. So we're normalizing it. So we are counting those who we cover, but we are not counting those who we turned away. So in all, and why we turned them away, who is constantly being left out in the system, we have no way to do that. And so this is something which worries me most, is that we are counting those who cover, but we are not counting those who we turned away. And then we are rejoicing on averages. So programmatically, so this overlooked thing, and normalizing of this overlooked thing, it worries me. And this is where I feel equity needs to be brought front and center in the design of programs. And women's time poverty needs to be integrated into it, because women who are poor, that doesn't mean that they have all the free time. And that access and time poverty needs to be taken care of. So this humanized approach is somewhere missing.
Wonderful, wonderful. So, Osama, you heard Vani, indicating a lot of kind of genuine issues. So, what does this sound like a problem of insufficient technology, or are these fundamentally kind of the social and systemic barriers, challenges, problems? How do you interpret this?
Hi, Vani, and hi, rest of the people on the screen. And Avishek, thank you. You also informed us about your preparation for the question, and I found your questions very, very interesting and timely and all that. Nutrition is not my subject, technology is, but the problem of nutrition is certainly my problem. So the issue that you are raising is actually not a technological problem. It's a systemic problem. It's an intentional problem. It's a design problem. It's a policy problem. And I just, forget about all the technologies. Just concentrate on human issue, human related issue, which is nutrition, right? Nutrition is what? What we eat, how does it affect our health? How are we prepared to create next generation physically, and so on and so forth, right? It's a daily thing. And what I found is that when a child is born or a mother is there at home, is there a subject called nutrition that is discussed within the family or within the education system or within the ecosystem? I would say no. Nobody talks about what food is more powerful or what is less powerful and all that, right? And even from the policymakers' perspective, we are identifying the problem of anemia, which is directly related to nutrition, which is directly related to food supply, and so on and so forth, and affordability. And then before this session, I was just trying to understand the hugeness of the problem, and I figured out that I will concentrate more from India, although I know we are from all over the Asia Pacific, and there is this regional issue and all that, and more populated countries problem also. But just take India as an example. We have about close to 365 million population of reproductive age group of women. Right. Let's say that's our, the bowl of population, which is actually the identification of the demography of the targeted community, right? And out of that, and they are directly supposed to be served by the AAAs, right? The Ashas, the Anganwadis, and the ANMs, right? The population of ANM is 2.4 million. And I just calculated by division and multiplication. It turned out that out of 205 million, these women who are responsible for the nutritional or the health issues of this population, it turns out to be that the per head responsibility is 150 people only. Actually, that means one of AAA is responsible to make in out of 365 days, only to target 150 women to counsel or talk or prepare them for good nutrition, let's say, right? And that's very interesting, is that, of course, this is a systemic problem, educational problem, communication problem, information problem, is that we are unable to do that. 150 people, that one person cannot do it. And of course, there is a whole list of all that. So I think, I don't want to go long, but I'm just trying to bring on board for the rest of all of us to think that how do we solve and create a health of or nutritional issue of 365 million women in India with the help of so many women, or some other system we need. Everything else come on that, right? Whether we create a technology for communication, whether we create a technology for automated, trusted information system for Ashas and the triple A's to access, and therefore they propagate to them, is a matter of design. And we can talk about the next 2-3 questions that you will come up with the solution that I have in mind. But this is what I identify as a problem. And this I need to actually learn from everybody who is the subject expert and in this area, is that what kind of communication and technological solution that we can provide to you to make this trustworthy solution for the problem that we have on board.
Wonderful, wonderful. And I think that actually kind of brings me to the. I'll continue with you, Osama. That brings to the natural question then, if you had to, you gave an example of many solutions, or where AI can actually help. So if you would like to bet on AI improving women's nutrition in the next, say, 5 years. It can be around community health workers. You gave example of ASHA and all. It can be for personalized, counseling. And I again borrow your word of phygital, digital, and delivering that physically. So, or it can be risk prediction. It can be language translation. What one bet you would keep on AI in improving women's nutrition?
So I would say that, like you were saying, that what in the next 5 years, the kind of solution that we can bring in is, I will just put myself as one of the village women, right? I am in a village. I am illiterate. I am uneducated. I have never gone to school, and I am anemic, or I have a health issue. I'm about to get pregnant or whatever. Just stand there in the middle of a village near Panchayat and then ask my question, who can help me with this trusted information? So when I sit there, I see that I am one of the part of those barely connected women. Only 25% women have ever used internet in villages. So that means I have an issue of technology access or meaningful access. I also have a problem of trust, because whatever information I get, I hardly can trust. I also have a problem of affordability, right? I might be able to be told that I must eat this, which may not be affordable to me or may not be available in my area. I also have a language that my rest of the world doesn't understand. I am also, not literate and educated, and so on and so forth. I also is a lower caste and unheard, unrecognized kind of population. Whenever I go to a panchayat, nobody hear me out. Nobody gives me solution, right? I also expect that people should come and tell me what to do, but they don't visit on time. They don't come on time. I'm already 3 months pregnant and things like that. And, I have a health problem and I don't know where to reach out. And therefore, I would create a problem which is community centric for sure. It should never be individual centric, because at a community level, community is the checkpoint. Individual is never a checkpoint. So never plan any solution which is based on individual mobile access or individual smartphone access or something. It should always be community. Walk into the community area and find your answer or a question. That's the way we need to plan the whole thing. So I would say that I'm sitting here. I have a communication problem. I have a language problem. I have a oral problem. I have a trust problem. I have a information non-availability problem. I have a affordability problem. I have no availability of pre-prepared about my future days so that I am better prepared. So those kind of things are not available. And how this can be in a trustworthy manner can be taken into consideration. And there is a role of AI here. There is a role of data, but that is not for the consumer or the citizen. That is more from the intermediaries.
I really love the angle that you are bringing from, like, from individual centric to community centric, which is more effective. And so I'll now invite Vani to kind of reflect on this point, because Vani, you have been working with community and as a thematic specialist expert. Which of these opportunities or which of these specifics that Osama was highlighting do you think, or which are most exciting for you, Vani?
All right. I want to start with the problem that we have to solve. And the problems I'd already mentioned were three. And a lot of, and why only reach out to the woman first? I just want to zoom out a bit to take it to program design and service provider support. And I want to touch on a little on program design and how technologies, digital solutions can actually reach the women who need it most. I want to, if I had to use AI today, and you need it at various levels, for those that would have access to smartphones, electricity, literacy, how can these technology help you with diagnosis of the right problem? Now, who is suffering the most are those that we are giving solutions to and not actually solving the problem. So I would want to use AI and better technologies for point of care diagnosis. Everyone does not need a pill, and maybe the pill is different for different people. So if we are running certain programs for reducing anemia, can we have anemia testing kits which are AI supported to really understand whether anemia is coming down? Because now surveys are also getting expensive. How can we use sentinel surveillance? How can we use better diagnosis of the problem on the ground? I don't think that we are doing that. That's one. I would want to use AI to who's getting left out so that I can get them back into the system, because we have a problem that we are good in bringing the woman into the system in pregnancy, but she doesn't stay on. How can I use the program reporting, which is coming, to start making better sense of it in phase one? Last but not the least, I would want to use AI for visualizing the invisible. So this is at a design stage for programs and program managers. In terms of the woman herself, I don't think I would differ that it's not only because it's not India alone, and it's not always the Anganwadi or Asha, and there are certainly 1 billion women now in Asia Pacific that are women of reproductive age. I would like to use different kind of solutions where traditional programs are not reaching. For example, women in preconception. How do you reach those women where no traditional systems are there? And how can technology reach those women to simplify measurements, simplify diagnosis, at least at a proxy level where there's no doctor? So for me, I would use AI at stage one, administratively, rather than getting onto these personalized apps and chat bots, which really don't really solve anything, to be very honest. Because for me, it's, this an app is not the breakthrough, to be very honest. And I think as nutrition communities, we need to understand that the breakthrough is that whatever I deploy for the last mile, and if that is successful, it will be successful for everyone. The problem is that we are designing programs, AI, based on those who have an app, those who have a phone, those who have a smartphone, and then seeing whether those that are marginalized, what can they get? I would take it the reverse. What is the problem that I have to solve? Who do I have to solve it for? And these problems will be different for service providers, for the woman herself. Maybe she doesn't want it. Does she want it? Her life is going well without you, right? Who needs it most? How can we get the workers' life simplified? And I have seen all these dashboards and apps. I've supported them also in several countries, especially the country that Osama also spoke of. And it's a huge cost. Will the government be bearing that cost? how are we simplifying process? So if we can simplify life, simplify processes, support decision making for those that are not in the system, because AI and models, they predict those who are already in the system. But I want to bring those who are not in the records, and then start tracking them. And if I have to use AI, I will only use it for that. My life is
Wonderful.
happy without it.
Wonderful, wonderful. I mean, then I'll again come to Osama. You have been invited in multiple forums, and I have heard you in the AI summit again in multiple sessions. Which of these many AI applications, and but as Vani was saying, one solutions may not fit all purpose. It has to be customized for different different solutions. For the solutions has to be customized for the purpose. So which is one AI application that now the policymakers nowadays are getting overly excited about today?
Yeah, let's first assume the fact that AI is certainly a pushed technology by the corporates and the technologists and the big technocrats and all that, and they want us to find a solution in AI so that the AI keep on working. But having said that, I just want to take a few points that Vani actually indicated in terms of so I'm taking the examples from what Vani said, is that the problem at hand that we have is of two kinds. One is preventive and the second is curative. Because you already have people, women, population who are going through this nutritional problem of anemia and various kind of things. We have to take care of them. So one part certainly falls into curative. And in that, we need to figure out how we can provide curative solutions using technology, because that enables you to do faster, more precision work and things like that. The second is more important for me, because so that we continuously do not only fight the curative problem, but also preventive, right? Which is actually, and if whenever you talk about preventive, it will fall into information, trust, education, counseling, preparing people, right? So that you don't get into the problem which requires a curative problem, And in the medical things, obviously the business is in curative, not in preventive. Preventive is the people like us who are sitting in terms of policy issues, population issues and all that, so that wo bimari na pade, they should not get sick, so that we don't have to. So the preventive is always 85% of the health issues and the nutrition issues and all that. So we need to figure this out, the preventive part, as to target this at a very young age level, right? Much before the adolescent level, where we create a policy of bringing nutritional subject as a part of the educational system and education process, both at a domestic and family level and the education level and the school level. I searched the education ministry and everything. There is no curriculum and topic or a subject called nutrition in our any primary or secondary education system. So that's number one. Number two, how do we create an information flow system which is trustworthy through intermediary, through technology and communication system, in the language and socio-behavioral ecosystem of the seeker of the knowledge or the information? And there you need to create a community which is phygital system, where you use the technology. And that is, again, I will go back to say that what Vani said is that we don't need AI for last mile provision. We need AI more from administrative data collection, and then help us reach to a certain kind of trustworthy solution which we can provide to the people. Right? So that means intermediaries level, we can use it. We can do the administrative level. We have the very, very trustworthy data where, let's say, there is a call center available for 1,000 people, where any lady can call from a toll-free number and talk to human that mere ko ye problem hai, I have this problem, I sleep 18 hours, I don't have energy. There should be some human who should reply, and that person may be dependent on a technological and communication system to give her the contextual reply. Okay, you are from Rajasthan. Oh, it's a dry region. Oh, you get such kind of food and such kind of fruits and all that. Why don't you eat this? Why don't you eat that? Why don't you eat that? Make it a practice. You don't rely on something imported fruit or imported something. You have this kind of contextual thing available in your area. I know you don't have water, so you can have these kind of fruits and these kind of things, which is also water specific and all. So this is contextual reply, because we also know that hyper local is the community is always hyper local, but we try to give them global solution. How can you have a global solution to a hyper local problem? Hyper local is 100-mile problem only. The water, the resources, the earth, the ecosystem, the rain, all these are hyper local, right? My existence, my affordability, my schools, my health centers, my need, my food, everything is hyper local. But we want to give a global solution. That won't work. So our information-based, trustworthy counseling or educative content should come through intermediary in a phygital manner to the person at a last mile in a hyper-contextual manner.
Fantastic. So now you talked about this hyper-local thing and reaching to the unreached. You gave example of Rajasthan. Now, do we have the equal digital infrastructure or internet connectivity to in a poor remote village of Rajasthan to a village in a southern state? So I mean that's the kind of tension I keep coming back to. The women most affected, what Vani was saying, the women most affected by malnutrition are often least represented in the digital systems. How can we visibilize the invisible, right? So, I mean, according to you, again, can AI help them if they're largely absent from the data, which again is being used by the AI systems for their internal training?
So I don't know. I mean, Vani, you can go ahead, but I'll take 2 minutes. The infrastructure that you talked about, that in the village level, of course, we don't have a meaningful information architecture or infrastructure available, which we are talking these days as digital public infrastructure, not available. They are available, but they're not usable to the public level. So certainly it has to be part of the design that all our health centers, community health centers, all our Anganwadis, all our ASHA workers spaces, schools and all that should be absolutely high level broadband connectivity available to the local people, on which various kind of content can be pushed. But these are only community driven spaces that we should identify. That's not very difficult, because government claims that all panchayat level they have created 100 Mbps pipe up to that level. So we need to actually not only think that we have prepared the road, but now you figure it out. Of course, you have prepared the road, but is that road that is workable for my vehicle, for my need, is the one that we need to translate into. So we need to certainly create a digital public infrastructure which is attuned to health needs, nutritional needs, educational needs, administrative needs, welfare needs, and so on and so forth.
Wonderful. Vani, why don't you come in on this particular point?
As I had said before, where would I use AI? Now we are supporting governments, partners across several countries in the Asia Pacific region, and excluding in conflict, humanitarian crisis. And so a package of, say, 5 services need to reach women in pregnancy. First, they need to be understood and integrated into, say, the maternal health systems. That has nothing to do with AI. So you need to create that in backend. So the backend is not only a digital infrastructure, the backend is an institutional infrastructure that appreciates that nutrition is a part of, say, maternal health programs. Once it's integrated, then for the administrator, there are various stages at which, using large language models, using AI infrastructure, having a human and a digital interface for diagnosis of a problem, telecommunication, reaching out to a doctor when it's need, and having an AI-based system which actually even reaches a doorstep at a fixed day, fixed time can be possible for those that are need. And there are ways in which it's happening, and I'll give you an example. I would use this for reducing the time lag to provide service, in visibilizing the invisible, and helping me ease my support for the service provider who is supposed to reach out to the X 200 women she's supposed to reach, but she can't reach because of various administration problems and others. Helping supplies reach where it's reached. And it's not always that the governments have to do. It's government partners, private sector, all have a role to play. And that systems can be used, right? Now for digital, but it's also reverse, right? Today digital, and I'll come to that, but today you have various geo-based AI-based centers where there is a doctorless doctor and a woman enters, and through just a eye and various eyelids, you can get to know whether it's anemia diagnosis or not. Through your earlobes, you can get to know whether you have anemia or not. Through various bands, you can get to know whether you have any other problem. Through various methods, you can get to know. It's the first proxy stage where you don't need to go. The second comes in the point of care diagnosis, so that you have now methods and machines, including solar, given with the mother, very simple ways to, through the ultrasound, to do the testing of fetal monitoring. There are innovations that have been done. Have they been taken to scale? What has failed? Why are they not being able to reach who they are supposed to reach? That's the second. Then comes into this the mother herself, when she's going to the place and she's not able to access service. What is the supportive system that you do so that she access service? So the ecosystem is not digital ecosystem. The ecosystem is differential approaches to reach those who are unreached, and whether X innovation, which could be digitally enabled or otherwise, helps you. That's the question that we are solving. Is that my question here is that we are okay with some people being missed in the system, and we are reporting. The reporting efficiency is 20%, and we're reporting numbers on that. No AI can erase that error, and that cannot be done. That's one. Second is digital, because you said it's a big problem and a menace as well today. You see the digital marketing of unhealthy foods that is going on. The Zomato, I don't want to use the word, but there are so many digital food-based delivery apps that are selling unhealthy foods. What are we doing to stop that? If we think that we're just going to take a digital app which can actually just take a photo screen of the food and give me my calories, proteins and all, are we going to be using the digital only for that? And who are we catering to? That is those that have that phone, and that is going to be an expensive phone. So I think the questions that you're asking are multi-layered. Who is this for? What technological solutions are available? But most important, rather getting swayed, how accurate are they to diagnose the problem accurately, to basically correct a design flaw? For example, if a technological solution can help me identify serum ferritin in the field, to tell me whether the deficiency, whether anemia is because of iron deficiency, I will definitely invest in it. And that's what the government of India has done now. A POC device to test serum ferritin on field, so that in areas where iron deficiency is not a problem, you can deploy some other solution. But how is AI? So suppose you train the worker, you give her this machine. Can AI reduce the lag time for diagnosis and taking action? Or how much is going to be the infrastructure for it? Because in some other countries, when I asked, they said, we don't have the money to do this. How is it going to be charged? How are we going to do it in conflict settings? So it also starts with what is the problem that you want to solve, rather than what is the solution you want to sell. And I'm interested in what is the problem I want to solve. And this AI goes as part of the pathway to a solution, but not the only one.
Thank you. Thank you so much, Vani. I see, we can go on and go on with such two diverse perspective, one on the nutrition challenges, one on the what AI can do. I see there are many excellent questions coming up in the chat. I know we have just 4 minutes left, but I just wanted to check if anyone from the audience wants to really come up and share a couple of thoughts or any questions, but be very brief. I see Nandini, Sudeshna, Shalini, Sulaiman, Sweetie. you are putting a lot of very pertinent questions. If anyone of you wants to come and voice over your questions. Arpita, if you can unmute.
Yes. Shalini ji, everyone who's asked a question, I can also read out for you from the chat. Would you like me to do that? Okay, go ahead. I think
I'd be
there's
happy
yes.
to come in.
Please, go ahead.
Thank you so much for an engaging session. It was very interesting to listen to Vani and of course Osama. And one of the most, rather a comment more than a question was, I believe that if we need any AI or technological advancements to enter the nutrition realm, they have to make cost effective any precision nutrition technique that we are trying to deploy. Like also Ms. Vani very correctly pointed out. And if there is anything that we can do to make sure that the money spent by either by the government or the person or even the beneficiary, if that reduction in the cost is something where AI or technology can help us, I think that can be a breakthrough. Over to you. Thank you.
Wonderful. Who wants to take it? Osama,
I'll take that. I think she spoke about precision nutrition, right? Now, the question before us for precision nutrition is, do we have a nutrition algorithm for women's nutrition which speaks of precision nutrition? Do we actually measure malnutrition of different categories in women? Do we measure women who are short, thin, young, overweight, anemic? And if so, then what is the medical nutrition therapy management protocol for them across countries? So till you don't fix the technical guidelines for them, normative guidelines, and then integrate them into public health systems, clinical guidelines or otherwise, all forms of precision nutrition will also fall flat. So for example, how are you going to diagnose? So that normative has to be established. And for maternal nutrition, I mean, so many years I have been saying that you screen a child for malnutrition, undernutrition, and you give the child a take-home ration in a country like India, double one, but do you screen a mother and do you do anything for her? Please, anyone can just put in a flag if you've ever seen a mother's malnutrition being screened apart from anemia, and that too using hemoglobin, and anything being done for her. So the problem is not about, and there are various reasons for it. Harmonization of protocols, harmonization on agreements on the normative. What are the cutoffs? Should we take waist hip ratio? Should we take only BMI, which is not now a good indicator? When should we measure? Gestational weight gain charts are not available, which hopefully should be there by the end of the year. So the basics, Nandini, for normative of what to do are not there for precision nutrition for women. And unless those basics are not there, I'm sorry, we all can just do our own measure. You can use your own cutoffs, which are going to be really, really bad. For example, POC devices are still not a part by WHO in various A's. There are still guidelines that they can tell you about X% of sensitivity and specificity. Okay, they can give you a proxy so that who cannot go can go here. But if there is so much of variability in a digital hemoglobinometer, and please see the variabilities that are there, even in anemia testing that is happening, the cell not being there, the training not being there, the qubits not being there, and blah, 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 not being there. And then once it's measured, where is it going? Who is reading it? Who is taking action? तो वो chain ही नहीं है. तो आप बिना chain के आप precision nutrition एक बहुत अच्छा word लगता है. But I think it's even at a clinical setting, we are not able to do this. But today world is talking about it. Not only this, chrononutrition. I'm speaking to a lot of people in Singapore who are talking about chrononutrition. कितने बजे खाना चाहिए, कितने बजे एक ऐप होना चाहिए, एक घड़ी होनी चाहिए जो बता देगी. तो मैंने कहा, I wish कोई घड़ी मुझे खाना पे ला सकती थी मेरे एक लेडी को. So I think we need to be cognizant of the normative. And why I'm here, and I'm glad that we both are here from a technical point of view of what needs to be done. And Osama says digitally, then how it can be done. बट जो ये वॉट फिक्स नहीं होगा तो ये डिजिटली कुछ नहीं कर पाएगा. तो आप मुझे बता दो, वेस्ट हिप रेशियो लूं कि मैं पीएमआई लूं, वर्कर को ये जानना है. और अगर मैंने लेना है तो वो टेप कहाँ है, वो चीजें कहाँ, और अगर आप मुझे टेप नहीं दे रहे हो तो कौन सा एआई बेस्ड मिरर दे रहे हो, उसकी क्या स्पेसिफिकेशन है और उसकी क्या सेंसिटिविटी स्पेसिफिसिटी है मुझे वो करने के लिए. क्योंकि मैंने ये सारी चीजों पे एक्सपेरिमेंट थोड़ा किया है. और थोड़े दिन बाद जब वो टेक्नोलॉजी फेल हो जाती है या आउटडेट हो जाती है तो वो कंपनी बार बार मुझे उसके अपडेशन के पैसे भी मांगती है। वो कौन देगा? वो कोई नहीं देना चाहता। तो वो चीजें ध्यान में रखनी पड़ती है।
I will just
Thanks.
add one point to close this, that all the technological system work on data, right? And unless we are extremely honest about data that we are feeding into the technology, it will keep on giving imaginary and expected answer, but not real answer. And AI is at the height and peak of that hallucinating answer and all that, right? So therefore, Nandini said that how cheap or affordable these technologies would be, we have to be in mind. So we need to just make sure that AI at the end of it is fed only on the basis of the data that you feed it, with all honesty and due diligence and consideration and participation. And the better feeding that will happen, the better result it will give. But AI otherwise is not, unfortunately, the caveat is that among us human beings who are concerned about the human problem, we somewhat get carried away to serve the technology more than the serve to the people himself, that the topic of the discussion or the concern. Yeah, just we have to be concerned about that.
Wonderful, wonderful. Thank you, Osama, and thank you, Vani. Thank you, everyone, for joining in. But before you leave, I just wanted to make an announcement that we have very interesting topics coming up in the next few webinars. We have the next session on Can Algorithms Detect Hunger? AI Solutions and Ground Realities. We have the next webinar, WhatsApp, chatbots, and counseling. Can AI really reach women? The third webinar we have automation versus human systems that we just talked about, that Osama just talked about. And we'll have again brilliant speakers joining those discussions. Please stay tuned, and we look forward to have you in our future webinars. Thank you, everyone, and have a great time ahead. Bye-bye.